Namaskar, welcome to PK's classes. Today we will discuss the mechanism of beta lactam resistance. So beta lactam ring, this is the beta lactam ring CO and one N is there. So this is the beta lactam ring, and all the antibiotics with this ring in their structure are called as beta lactam antibiotics. And there are four classes of beta lactam antibiotics. One is penicillins, two is cephalosporins, three is carbapenems, four is monobactams, and these are the general structures of these four classes of beta lactam antibiotics. So beta lactam ring, this is degraded by beta lactamase. So beta lactamase is the enzyme produced by bacteria, and you can see the penicillin structure is broken here, and the cephalosporin structure, the penicillin structure, the beta lactam ring is broken here. This is the area where the beta lactamase breaks the beta lactam ring and produces the inactive metabolites which do not have the antibacterial action. So you can see this beta lactam nucleus is present in penicillins, carbapenems, cephalosporins, the monobactams. So what to do? We can use one beta lactamase inhibitors. So these are some of the examples of the beta lactamase inhibitors. So first let us discuss that the beta lactamase, which is produced by gram-negative bacteria like Enterobacteriaceae, including Citrobacter, E. coli, Klebsiella pneumoniae, Morganella, Salmonella, Shigella, Proteus vulgaris, other gram-negative bacteria like Haemophilus influenzae, Neisseria gonorrhoeae, Pseudomonas aeruginosa, gram-positive bacteria like Staphylococcus aureus, acid-phase bacteria like Mycobacterium tuberculosis. All of them can produce the enzyme beta lactamase, which breaks the beta lactam ring, which destroys the beta lactam ring in the structure of penicillins, cephalosporins, carbapenems, and monobactams. And this is the region of beta lactam resistance. So beta lactam resistance, the first region is bacteria producing beta lactamase, which destroy the beta lactam ring and is responsible for the loss of antibacterial activity of beta lactam antibiotics. So there is beta lactam resistance. So we can prevent this resistance by using the beta lactamase inhibitors. These are the beta lactamase inhibitors. So you can see our previous class on beta lactamase inhibitors. With beta lactamase inhibitors with beta lactam core, the suicidal inhibitors, and without beta lactam core, the non-beta lactams or non-suicidal inhibitors. So you can refer to that class. So the first mechanism is beta lactamase, because the bacteria can produce beta lactamase. So production of beta lactamase by bacteria to destroy the beta lactam ring is the major cause of resistance. This is the first or major cause of resistance. So and we can prevent that by adding one beta lactam antibiotic with a beta lactamase inhibitor. For example, amoxicillin plus clavulanic acid. So that is that can prevent the resistance to amoxicillin. So let us take the example: amoxicillin plus clavulanic acid. And clavulanic acid is the beta lactamase inhibitor which can prevent the resistance to amoxicillin, the beta lactam antibiotic. The second mechanism of beta lactam resistance is there is decrease in permeability of the outer membrane. So the drug cannot enter into the bacterial cell. So that there is decrease in influx of beta lactam antibiotics due to alteration in the outer membrane proteins. So if there will be alteration of outer membrane proteins, then there will be no influx, decrease in influx. Similarly, there can be increase in efflux of beta lactam antibiotics because of the efflux pumps, and those pumps will cause the efflux of the beta lactam antibiotics to outside. So when it goes outside, that means there is loss of activity. So increase in efflux of beta lactam antibiotics occurs because of the efflux pumps developed by the bacteria, and these pumps actively pump the drug from the bacterial cell. So this also causes resistance. So 3 causes. Then the 4th cause, you can refer to our earlier class on the mechanism of beta lactam antibiotics. In the final step of biosynthesis of the cell wall, there is peptidoglycan, which is the essential constituent of the cell wall of bacteria. In the final step, there is the enzyme transpeptidase, which causes the cross-linking of the N-acetylmuramic acids. You can see N-acetylmuramic acid is connected to here 5 amino acids. The 3rd amino acid from one N-acetylmuramic acid is cross-linked with the 4th amino acid of another N-acetylmuramic acid, and this cross-linking is done by transpeptidase enzyme. So beta lactam antibiotics bind to this transpeptidase enzyme, also known as penicillin binding protein, because penicillin is the first beta lactam antibiotic. So beta lactam antibiotics bind to this transpeptidase, inhibit this cross-linking, so there will be no peptidoglycan biosynthesis and no bacterial cell wall biosynthesis. So beta lactam antibiotics, by binding to the transpeptidase, inhibit the cell wall biosynthesis. So if there will be mutation of this transpeptidase or penicillin binding protein, that also can produce resistance. So that is the 4th cause of resistance, where there is mutation of penicillin binding protein. So there will be production of an altered penicillin binding protein, and that lowers the affinity of beta lactams for this penicillin binding protein or this transpeptidase, and this causes the resistance to beta lactam antibiotics. One more cause of beta lactam resistance is there, one more mechanism is there. For that, we need to understand the programmed death in bacteria, which is also known as autolysis. So autolysis is a self-digestion of the cell wall by peptidoglycan hydrolases called autolysins or autolytic enzymes. So both synthesis and hydrolysis of peptidoglycan are necessary. Synthesis, as we have seen this, synthesis N-acetylmuramic acid and N-acetylglucosamine are the chief constituents, and there is cross-linking of 3rd amino acid of N-acetylmuramic acid with the 4th amino acid of the other chain, and the simultaneously both peptidoglycan biosynthesis as well as hydrolysis also occurs for building the cell wall, and so we can say the autolysins are part of the normal cell growth activity in bacteria. However, there are inactivators or inhibitors of these autolysis or autolytic enzymes, and beta lactam antibiotics, another mechanism is they inactivate the inhibitors of autolytic enzymes. So beta lactam antibiotics they actually facilitate autolysis of bacteria. So resistance occurs when bacteria inhibits the release of autolysins and also inhibit the inactivation of the beta lactam, inactivation of the inhibitors of autolytic enzymes by beta lactam antibiotics. So in this is another cause of resistance to beta lactam antibiotics like penicillin. So these are the 5 major mechanisms of beta lactam resistance. Thank you.